Dr. Muhammad Shahbaz is a surgeon, but he's also a PhD candidate at Shandong University in China. He's originally from Pakistan. He's written widely on Belt and Road and the health implications for all. We wanted someone different, someone new, someone younger, and someone who not only represents what the stakes are today for a young practitioner, but also someone who will grow with the future of Belt and Road. And I'm not saying that we won't, but I'm just saying that he will more immediately. I think I'm aging us all over here. But someone who really has the opportunity to bring Belt and Road to its full fruition and to its new reality. So if you can join me in welcoming Dr. Muhammad Shahbaz.
Hello everyone, very good morning. 大家你好。你好，我非常感谢Professor Gabriel and Professor David and Miss Edda and Miss Trudy for inviting me here, and I would like to congratulate the Faculty of Medicine for its 130th celebration. So I've been in China for the last 12 years. I'm a student in Shandong University. I'm doing PhD. So it has been a great time in China. Now I am doing a fellowship in robotic surgery at one of the top robotic surgery institute in the world in France. So I have been involved in this One Belt, One Road program. I have studied the feasibility, and I'm trying to connect and be the part of this Belt and Road initiative for the healthcare in Pakistan, connected to China and Pakistan, connecting the France and Pakistan, and connecting the France and China. So I will try to give a brief overview of my 10 years in one slide. I have been here in China for last 12 years. So it was good to study the Chinese culture and learn Chinese. And the Faculty of Medicine and Professor David and Professor Gabriel, they found me. Actually, I wrote an article about the One Belt, One Road, my own ideas, how we can make it as a health corridor. So I arrived in China in 2006, and I started my training with one of the famous professor in China. He is Professor Nugent, if you can see in the top right. So, no scar surgery in China. So I have been training under his supervision for last 8 years. And I visited the Great Hall of China on the invitation of the Ministry of Education and Health, and meet Liu Binjie. And I had a discussion about the One Belt, One Road, the healthcare policy. And also I was on the Chinese Education TV, if you can play the video.
人民大会堂迎来了108位优秀的中国政府奖学金来华留学生。
来华留学生通过与专家学者交流探讨，逐渐加深了对中国政治、文化、历史知识的了解。一直对中国文化很着迷的阿里参加了这次活动后，他对中国政治也有了兴趣。
老师给我们介绍中国的这个文化，还有中国的民族，还有中国的少数民族，然后这个孙他们怎么安排这个政府。然后他们怎么解决这个很大的问题？因为中国这个国家太大了，我佩服中国的政府，因为我是一个医生，我觉得现在中国的医院也有这个微创和机器人手术，然后我也希望中国可以帮助这个“一带一路”的这个国家。So my idea is that China is very developing very fast. I was here in China in 2006, and I saw the Beijing Olympics, and I saw the China rising. And in Jinan there was less building, and when I came here there were skyscrapers, and now the China is developing very fast. So I visited many hospitals in China where they do this the training for the robotic and laparoscopic surgery. I was in Chongqing where I see this the emergency relief and emergency response center, and I also was in Chongqing where I see this the training center for the robotic surgery. And this is our team in Shandong University. I work with Professor New and Charity Foundation to help the kids in the remote areas to facilitate them in the education. Can you go to the next slide? Okay. So I was in Australia in 2007 with my professors. So it broadened my point of view when I visited the different universities in Adelaide, in Sydney. So I visited the departments of anatomy, and I see the big, the elephants, the skeletons. So it broadened my ideas. So, next. So then I was in Pakistan. So I was invited by the president of the College of Physician of Surgeon in Pakistan to visit the different areas to analyze this the infrastructure in Pakistan for the healthcare system. So it was a great opportunity for me to discover the training centers in Pakistan where we have the mobile facilities for the breast cancer care, and also this is the robotic and the laparoscopic training center. And I had the opportunity to visit the College of Physician centers. There are actually 12 centers in Pakistan, and there is more need because Pakistan is a big country by population. It has 200 million population, and there is need of more infrastructure development in the healthcare. And there are about 340,000 new cancer patients every year, and most of them, about 60% of the patients, they don't have the adequate care for the cancer treatment. So there is a need also to train the surgeons and the doctors in Pakistan. We also have the system of the British system. After the 1947, the independence, that we still have the healthcare infrastructure delivered by the British government. So there is a big need to develop the infrastructure for the training in the medical sector. Can you go to the next slide? So I had the opportunity to go to France and do this fellowship in the robotic surgery and one of the advanced training center in France. So when I was there, I had the idea why I don't take this technology to Pakistan, because I'm the first surgeon from Pakistan who is doing this training in France. So I talked with the president of the institute, Professor Jacques Maresco, who did the first telesurgery in the world. He's very famous in the world. This Professor Jacques Maresco is sitting here. So I talked with him. I arranged some visits. I invited the ambassador of Pakistan to visit the institute. He is the ambassador of Pakistan. He visited the institute, and then we are on the way to collaborate between the College of Physician and Surgeon of Pakistan and between the France. So as you know, everybody is talking about China, 1 Belt and 1 Road. And when I came to China, I see the Beijing Olympics. I saw the Chinese Dream, Chongqing, and then I hearing about 1 Belt 1 Road. My perspective of this Itai Ilu is different. I want to make this Itai Ilu as the health corridor. So I gave this idea. I wrote an article in China Daily. It went to the Telegraph, and then circulated, and I am standing here today to give speech. So you can see the Belt and Road, and I want to make it as the health corridor. Can you go to the next? So all this, the presentation is my idea. So it totally is my own idea. So I want to give this logo to the health corridor. This is the Wi-Fi system, is the telemedicine, is the hospital, and is the pharmacy, which are an essential part of the hospital. So in the new century, with the development of the medicine, it is becoming more and more telesurgery, telemedicine, and there is the requirement of the new century. So, develop this the health corridor. So I draw a map. So I want to have this the regional health corridor and the regional healthcare center in every country, which can cover the different areas nearby. So it can be in Beijing, in Jinan, where I study, in Xi'an, in Urumqi, which can cover this area, and in Russia, it can be in this Tomsk, and in Moscow, which can cover this region. And also in Pakistan, is the Pakistan and the China Economic Corridor. It can cover this region, and Tehran and Istanbul and so on. So can you go to the next slide? So the regional healthcare center, according to my idea, it can consist of the hospitals, IT lab, and the Big Data Center, Pharmaceutical Institute and Paramedical Institute, Medical University, Central Research and Lab, Innovative Medical Training Center, and Multidisciplinary Center. So these can all be connected together and interlinked together. Next. So this is the map I draw for my regional healthcare center. So it can include a robotic surgery institute, a telemedicine and a research lab, central lab, hospital, pediatric hospital, different hospital department. It can be connected with the big data and the audiovisual center and the pharmaceutical lab and a different institute. Next. So this is a short video about the Professor Jack Maresco. He did the first telesurgery in the world in 2001. So I had the privilege to work with him in the Robotic Surgery Institute.
About distant care or telemedicine.
So this is the
in areas with doctor shortages, when care is needed, but there is no medical professional or device around that location, we need help.
This doctor is preparing for a surgery that will make medical history. That's because while he's in New York City, is in France, 4,000 miles away.
To accomplish remote surgery, you need to have a perfect robot, and you need to have a high-speed system, and that was very difficult to find. Are you ready now?
Now, using 2 joysticks to maneuver the robotic arms, he begins the delicate procedure to remove the diseased gallbladder.
Professor Maresco was sitting in New York and he was performing a surgery on a patient in Strasbourg, France.
If the robotic arm malfunctions, the scalpel could slice open organs, causing massive internal damage or even death. But almost 1 hour after the first incision, the surgery is over and history is made.
So we can also use this, with the advancement of the technology, we have this Watson doctor which can help us to diagnose this disease. So
when Watson goes to work in a particular field, it learns the language, the jargon, and the mode of thought of that domain. Take the term cancer, for instance. There are many different types of cancer, and each type has different symptoms and treatments. However, those symptoms can also be associated with diseases other than cancer.
So Watson can study thousands of research articles in 1 minute, and it can help the doctor to have the precise diagnosis.
Of pages of literature that capture.
So the research and development is also important part of this the medicine. So where the institute where I am working, they have this visible patient where we can see the patient internal organ. We can construct the 3D image of the patient, which can help to have the better diagnosis and precise operation with the less incision and the less complication. We are working on this technology, and in the future it will be more used in. So it can also be used in there's also exoskeletons, and everybody nowadays is having their personal sensors, and in the future there will be end of chemotherapy, and there will be no scar surgery where we will operate without any scar, and there will be no need for taking the daily pills. We will have some kind of sensors. They will release the dose according to the patient need, and there also 3D printing, which we can use in the medicine for the orthopedics, prosthetic joints, and so on. So the Pakistan has a huge opportunity. Is the land where we have the 7th biggest pool of scientists, and we also have this the big pharmaceutical industry, and we have around 20,000 specialist doctors. We have around 175,000 doctors which need constant training, and with the training demand increase, it is more important to have this link between China and the already developed countries where they have this developed training system and training institute. So if we can connect the the China and the other developed countries with this route to Pakistan. It can help to train the doctors and surgeons. So Da Vinci robot is nowadays used in robotic surgery. There are about 38 robotic robots in China, and China has a big infrastructure for health, and it can be a good opportunity for Pakistan and other countries connected with the Belt and Road to get this infrastructure and also the traditional Chinese medicine. So I would also like to have my different universities from China to open their international campus in the countries in the region on the Belt and Road. So they can be a multidisciplinary link between the hospital, universities, training center, research and development, IT department, and pharmaceutical institutes. And we can also have this mobile hospital and medical tourism. We can connect the Belt and Road using the mobile hospitals, and we can help the patients to move from one country to another. And this is my idea of why we don't, the Belt and Road countries, why we don't develop a unique force, the medical force, where we can have the force of the doctors, nursing staff, and paramedical staff. If there is an emergency, these doctors can move from one country to another country using the Belt and Road. So this is the plan. Is my plan. We can also have this Belt and Road Health Forum. We can have this cooperation between different faculties and exchange programs. So, thank you. So this is the future of the medicine. Can you play this video, the last one, this one? Yeah. How I see the future of medicine, it will be totally automatic. So you will have your own robot. You just press a button, and it will help you to operate. So you can enjoy the video. So just you have the emergency procedure, you click on it, and the robot will operate for you. So it will have the proper scanning of the body, it will operate, it will take incision, it will stitch, everything will be automatic by the robot. So you will see in the next 20 years, 30 years is a reality, it will be a reality. And there will be a stapling and close the door. Next.
You will be able to
So I would like to thank all the faculty of medicine of Hong Kong University and Professor Gabriel, Professor David, Miss Ada Leong, and Professor Maresco, and Professor Nguyen, and Miss Leonora, and Miss Trudy Wong for inviting me and making this happen. 我非常感谢大家，谢谢你们，merci beaucoup。